Hi class, welcome again to another session on biomaterials. So we have been discussing soft tissue implants from our fourth unit. So we already discussed sutures in the last video. So let us move on to discussing surgical tapes now. So surgical tapes are usually used. I mean, when you suture a wound, you have to puncture the area around the wound to in order for the thread to go through the skin, right? Also, while suturing, you're pulling the skin together and tying it with a thread. So this often induces pressure on the surrounding tissue. Already the surrounding tissue is inflamed because of the incision that has been made or the injury that has occurred. So you are escalating the chances of inflammation by puncturing the wound ends and trying to sew it together, right? So this can induce pressure necrosis, which is death of cell due to induction of pressure, right? Also, uh, while suturing, often a scar appears, right? Then the stitch abscess can also occur because you have the stitch wound, and infection around the stitches can occur, which can result in stitch abscess, and the tissue as such might weaken because you are suturing it, you're pulling it together, and it is withstanding a lot of tension. So surgical tapes can avoid all these problems, that is the presence of pressure necrosis, then skin tissue, scar tissue formation or stitch abscess or weakened tissue. However, there's a tiny problem with tapes is that the wound is often not a straight line, right? You have misaligned wound edges, and sometimes the addition of or the sticking or the surgical tape becomes very challenging if the wound is moist or dirty, right? Often there can be hematoma, which is bleeding from the wound, or wound drainage. You can have blood serum oozing out of the wound, and that would result in sogging of your surgical tape, and that would separate the tapes. So basically the tape wouldn't stick to if there is wound drainage or hematoma or bleeding in the wound. So these are the major disadvantages of surgical tapes. So the type of incision also influences the wound strength and the scar formation. You know, if you are imagining a scenario where fatty tissues are cut and the wound is closed using surgical tapes, now that would result in retraction of the muscles, which would in turn result in scar and poor cosmetic appearance. However, if the muscle is not cut, a taped wound would have higher strength when compared to a sutured wound, and due to the higher strength of the scar tissue, right? So if you are like not cutting the muscle, if you are making a superficial incision, then surgical tape would result in really strong healing, and would have higher strength when compared to using sutures for that case scenario. So tapes have also been successfully used for assembling scrapes of donor skin from skin graft and correcting nerve tissues for neural regrowth. So surgical tapes have been popular. However, they do have their own disadvantages, because of which, on certain occasions you can't use surgical tapes. Now, adhesives are like glue, right? Surgical glue. So, there are certain salient features of an ideal surgical adhesive, which are as follows. First of all, it should be wet and it should bind to tissues. Right? If you are trying to stick a wound together, then you need a gum that will bind tissue, right? You can't just use any glue to stick the tissues, right? So it should facilitate rapid polymerization without producing excessive heat or toxic byproducts. Pol- Toxic byproducts is understood, but excessive heat would damage the surrounding tissue, and that is not what you want from an adhesive. So adhesive should rapidly polymerize. At the same time, it should not heat up to a really high temperature, because that's something that you do not want. So an adhesive should be reabsorbable, because as the wound heals, You do not want the adhesive to remain as it is. You want the adhesive to slowly melt off when the wound is like closing up, right? Also, it should not interfere with the wound healing process. It should not affect the wound healing as such. So these adhesives should be easy to prepare in the operation theatre. You do not want the surgeon to spend a few hours preparing adhesives, right? You want it to be as quick and as ready as possible. It should be viable in large scale production because, for commercial reasons. And it should be sterilizable and have a long shelf life. You do not want to induce infection due to use of adhesives. So it should be sterilizable and it should have a long shelf life, right? The main strength of adhesives is due to the covalent bonds between the amines, carboxylic acid and the hydroxyl groups of the tissues. So these adhesives, they form really strong bonds with these groups that are present in the tissue, and because of which they, stick to the tissues and try and close the wound. So there are numerous adhesives available, but alkyl alpha cyanoacrylate is the most commonly used group of adhesives. Some popular ones are methyl 2 cyanoacrylate and then ethyl 2 cyanoacrylate. These are the two very very popularly used chemical substances that are that as adhesives. So adhesives have lower strength and lesser predictability, right? So they are not as strong as suture or surgical tape. So their strength is low and therefore they are used only to repair fragile tissue injuries. So suppose if there's an injury in the spleen, or if you want to repair the liver, kidneys or the lungs, then adhesives can be used. If it's a big superficial big cut in the thigh, or if the surgeon is trying to repair your quadriceps, then adhesives is probably a very bad idea because they do not have that much strength. So cords would never be as strong as they were previously, right? So adhesives have also been prepared from fibrinogen, so which is one of the clotting elements of the blood. We all know blood proteins. So this material has sufficient strength and elastic modulus to sustain the adhesiveness for anastomosing nerves, microvascular surgery, dural closing, bone graft fixing, skin graft fixation and other soft tissue fixation. So adhesives made from fibrinogen are strong enough to suture or to stick together a nerve, microvascular surgery, small blood vessels, the dura mater, dural closing, the bone graft fixation, skin graft, and so on. Right. So this adhesive material, according to your book, it is available in the US, but the FDA approval is still pending in the. Sorry, it's available in Europe, and the FDA approval is still pending in US. So a bit of an assignment for you guys. Please go and check if this material is commercially available in the US, just for your general knowledge. I hope you had a very fruitful session learning about adhesives and surgical tapes with me. I shall see you again in another video where we shall discuss maxillofacial implants. I hope you take care till then.